We're up against votes, so if anybody leaves and doesn't hear my questions, I won't be offended. But I have 5 minutes remaining. I saved it for the end to try and cover things that haven't been covered. Dr. Lasasso, what's the radical free market solution to this? Just clear out all the underbrush, and what would get rid of all the history? How do we fix this? You got like a minute to solve it all.
Oh, that's all.
From scratch.
Geez. I mean, if we're just in the PB, I mean, I guess
I was told you were a free market guy.
Right. So of course, the original sin was allowing for no tax on employer-sponsored health insurance benefits. So that weakens.
I agree with you there.
That weakens the incentives that the payers have to even really think about and push back. Because a lot of what we talked about here today that I think troubles me is that we tend to be ignoring the role of the payers. The payers are the ones sitting there looking at the proposals from multiple insurance, vertically integrated or not. They still have choice. If I don't like T-Mobile, I'll go to AT&T, right? So I can't really be ripped off that much, right? Even with the 80% that the three vertically integrated insurance chains.
What if Apple owned AT&T?
Sorry?
What if Apple owned AT&T? That's my concern. That might be a better analogy.
Well, yeah, but then I could still go back to T-Mobile.
Okay.
But
with an Android.
So okay, I mean, I don't want to monopolize your time here, but if you want to just scorched earth, get rid of
the original sin was telling employers that they should provide this, and then giving them the government benefit to make that, and then not extending that same benefit to individuals who tried to go out and buy health care. So I agree with you on that. Dr. Frank, or maybe it was Dr. Mattingly, I don't know, one of you was asked about antitrust action, and it didn't seem like there was a clear-cut case here given the existing law. So I don't want to relitigate that question. I want to ask a question, is there one piece of law that we could pass? Since the existing law doesn't seem to be actionable or clearly actionable in this situation, is there a rule that we could pass that would fix this, the anti-competitive nature of it?
Well, I have at least an idea about how you could get rid of some of the, attenuate some of the game playing, the regulatory avoidance. What you might do there is sort of handle it the way we handle multinationals, which is insist on transfer pricing. That you have transfer pricing rules that somehow reflect something close to fair market value. Because right now, Dr. Van Nuys and I have both made the point that there's a lot of game playing that can be done within that vertical structure to avoid regulations, to avoid...
What is transfer pricing? What do you mean by that?
So transfer pricing is, I'm a PBM and I sell services to the insurance company. Well, if my insurance company is, their profits are regulated, then I'm going to charge them a lot because that's on the books as a cost, even though it's revenue to the PBM that goes back to the parent company. And so those second set of revenues are not regulated. They're not subject to like margin regulation in health insurance. And so by doing transfer prices, which insists on constraining what can be done in terms of who can charge the other one what, you eliminate or you reduce the ability to play games to avoid regulation and taxes and things like that.
Okay, 1 minute remaining. Dr. Van Nuys, you had 4 suggestions. If you could implement just one of those in legislation, what would it be?
Transparency.
And what would that look like, transparency? How would we impose it?
So
pricing?
So what I want is aggregate benchmarks of average prices at different points in the transaction system. So CMS already publishes a series called the National Average Drug Acquisition Cost, NADAC, that they collect with surveys, and they aggregate it, and they publish it monthly, and anybody can get it. I can get it, you can get it. And that gives us a benchmark to evaluate one particular transaction. That's the transaction between the pharmacy and the wholesaler. the prices between the pharmacy and the wholesaler. I want something like that at the different transactions in the chain. So I want to know what PBMs are charging health plans to settle a claim, what PBMs are paying pharmacies to settle a claim, what PBMs are negotiating with manufacturers. And I want an average benchmark like NADAC, high quality net.
What would you do with that information? Who would use it?
Market participants would use it to understand whether the prices that they are being offered by whoever their counterparty is, the PBM, are fair, are reasonable, right? So any of those market participants could use that benchmark. They don't have anything like that now.
All right, thank you very much. My time has expired, and that means we are done with the hearing. I appreciate the indulgence of my ranking member here. Did you want to say anything before we close?
Just, Mr. Chairman, I want to thank you very much for handling this committee hearing in a nonpartisan way. I think America is much better off with the information we got today. Barely scratched the surface, but got some work to do, and I want to thank our witnesses for your good testimony today. Much appreciate y'all.
Well, that concludes today's hearing. We thank our witnesses very much for appearing before the committee. Without objection, all members will have 5 legislative days to submit additional written questions for the witnesses or additional materials for the record. Without objection, the hearing is adjourned.